All right, now we're going to talk about hyperinsulinism, right? So what is hyperinsulinism? This is where a moment of time where there's an excessive secretion of insulin in your body, right? So the concentration of insulin rises. This usually is a result of incidence of type 1 diabetic. So type 1 diabetes, so diabetes mellitus, is an autoimmune disease where you develop these autoantibodies attacking your beta cells, your pancreatic beta cells, and so your body is not able to produce any kinds of insulin. And so these patients are exposed to high instances of hyperglycemia, so high blood sugar, right? So insulin's main function is to do what? Bring blood sugar down. So you have high blood sugar, right? And so the form of therapy for people that have type 1 diabetes is injection of insulin, right? But what happens sometimes is because a lot of the original forms of injection now is usually a needle, now they use patches, and now they're even working on the artificial pancreas, right? And so these patients that were usually giving themselves injection of insulin, there is instances where that dose of insulin may have been too high, right? And so that high insulin levels leads to the phenomenon called hyperinsulinism, right? And so this basically means the body has too much insulin, right? So what would you notice about someone that has high insulin levels in terms of blood sugar? What would happen to their blood sugar? Their blood sugar would go down, right? So they experience instances of hypoglycemia, right? So low blood sugar. And so people with hypoglycemia experience certain symptoms, right? So hypoglycemia is a very dangerous condition if it's not treated immediately, right? So the blood sugar concentration is low. So you have the low glucose concentration due to excessive secretion of insulin, right? And so what are some symptoms? So you have low blood sugar, right? That's the initial symptom that they use, some kind of blood test thermometer for the sugar. And when you have low blood sugar, your body goes into this fight or flight response. So you go into this sympathetic response. And so a lot of symptoms that people arise from is, for example, majority of them are behavioral, is anxiety. They have this anxiousness. So this neural input, you have, for example, nervousness, lightheadedness, a sense of unconsciousness, right? So they're about to faint. Right, so they have this feeling of being unconscious. They get dizzy, right? They experience all these symptoms of hypoglycemia, right? And so if this is not treated immediately, this can even, the final symptom or sign, this eventually can lead to death, right? So it is a very, very dangerous condition, right? It needs to be treated immediately, right? And so if I were to ask you, you're a healthcare provider, and you want to treat this person with hyperinsulinism, what would you treat them? What would be the possible treatment for this condition? Think about it. What's going on here? A lot of insulin means what? Very low blood sugar. Low blood sugar leads to these symptoms and signs, right? So how would you fix these symptoms of hypoglycemia? So the treatment usually in the cases is sugar. So patients are given some kind of alternative. So you can have oranges, candy, soda, something that has a very high sugar concentration. But people usually use oranges, the best form to prevent any kind of hypoglycemic instances, because this usually, due to the high glucose index of the actual fruit, people have a tendency of responding much more rapidly to the hypoglycemia induced from the hyperinsulinism.